Hey everyone, let's talk about something that's more common than you might think. Pneumonia. It's a word you've probably heard tossed around, especially during cold and flu season. But do you really know what it means? Pneumonia is actually a major health concern worldwide, affecting millions of people every year, from kids to seniors. You've probably heard the word before, but what exactly is it, and why does it matter? Let's break it down and clear up some of the confusion, because understanding pneumonia can help you protect yourself and your loved ones. First, pneumonia is an infection that inflames the air sacs in one or both of your lungs. These air sacs, called alveoli, are where your body exchanges oxygen and carbon dioxide. So when they're not working right, your whole body can feel the effects. Those air sacs can fill with fluid or pus, making it hard to breathe and leaving you coughing, feverish, or just feeling totally wiped out. You might also notice chest pain, chills, or even confusion, especially in older adults. But not all pneumonias are the same. There are a few different types, and knowing which is which can make a big difference. Each type has its own causes, risk factors, and treatments. So let's take a closer look. The most common kind is community-acquired pneumonia. That's the one you pick up from everyday life, maybe from someone coughing nearby or touching a surface with germs and then touching your face. Then there's hospital-acquired pneumonia, which, as the name suggests, happens when you're already in the hospital. This type can be more serious because the germs involved are often tougher to treat. There's also aspiration pneumonia, which can happen if you accidentally breathe in food, drink, or even saliva into your lungs. This is more common in people who have trouble swallowing or certain medical conditions. So what actually causes pneumonia? Most of the time, it's either bacteria, viruses, or, less commonly, fungi. These germs can enter your lungs in different ways, through the air you breathe, or sometimes from infections elsewhere in your body. The most common culprit is a bacterium called Streptococcus pneumoniae. It's responsible for a large number of pneumonia cases, especially in adults. But viral pneumonia, like the kind you can get from the flu or even COVID-19, is also out there. Viruses can spread quickly, especially in crowded places or during outbreaks. Fungal pneumonia is rare, but it can affect people with weakened immune systems. This includes people undergoing chemotherapy, those with HIV/AIDS, or anyone taking medications that suppress the immune system. Now let's talk about who's at risk. Pneumonia doesn't discriminate, but some people are more vulnerable than others. Pneumonia can hit anyone, but certain people need to be extra careful, like older adults, young children, or anyone with a chronic illness, like asthma, diabetes, or heart disease. These groups are more likely to have complications or need hospital care. Smokers and people with weakened immune systems are also more likely to get really sick from pneumonia. Even lifestyle factors, like poor nutrition or heavy alcohol use, can increase your risk. So, what do you do if you get pneumonia? The first step is to recognize the symptoms. Don't ignore a persistent cough, fever, or trouble breathing. Early action is key. Treatments depend on the cause. Bacterial pneumonia usually gets antibiotics, which can help you recover faster and prevent complications. While viral pneumonia needs plenty of rest and fluids, sometimes antiviral meds if it's severe. Over-the-counter medicines can help with symptoms, but always check with your doctor first. For fungal cases, you'll need antifungal medications. These are usually prescribed for people with specific risk factors or underlying health issues. No matter what, it's important to follow your doctor's advice, get lots of rest, and drink plenty of fluids. Recovery can take time, so be patient with your body and don't rush back to normal activities too soon. Bottom line, pneumonia is no joke, but knowing the signs and getting early treatment can make a big difference. Prevention is also important. Washing your hands, getting vaccinated, and avoiding smoking all help lower your risk. If you're feeling sick and having trouble breathing, don't wait. See a healthcare professional. The sooner you get help, the better your chances of a smooth recovery. Take care of yourself, stay informed, and keep those lungs healthy. Remember, a little knowledge goes a long way when it comes to your health. Thanks for watching.